Okay, Betsy, we just started the dial, so give it a second, and we're going to make sure we get the first person on the line. So we're just doing our initial dialing process. Getting through the first names right now. Give it just a second longer. People are just hearing the 30-second message, so that's why. Okay, Betsy, you're ready. You're good to go.
All right. Well, good evening and welcome to the Physicians Committee's telephone town hall call with Dr. Neal Barnard, President of Physicians Committee. Dr. Barnard will be joined tonight by 3 of PCRM's campaign experts. My name is Betsy Wasson, and I'll be your moderator for tonight's call. We'll begin in just a moment, and we're so excited to have you join us tonight because we have so much to share. We'll be updating you about the progress that we've made in the efforts to stop cruel animal experiments in Taiwan. We also have some very exciting late-breaking news to give you, and we'd like to also let you know how you can continue to help make a huge difference in our work to stop the suffering for animals and people. Before we begin the call with Dr. Barnard, a few quick points. Right now we're in the process of dialing out to thousands of PCRM members around the country, so just stay on the line and we'll hear from Dr. Barnard shortly. Also, we want to hear from you during the call, and if you would like to ask a question, please press 0 on your telephone keypad at any time during the call, and you'll be connected directly to one of our staff members, and they'll take your questions and we'll answer as many questions as we can live on the air. So again, anytime during the call, just press 0 to ask a question. And if you have just joined us tonight, good evening, and welcome to the Physicians Committee Telephone Town Hall with Dr. Neal Barnard, President of Physicians Committee. I'm Betsy Wasson, and I'll be the moderator for tonight's event. We plan on keeping this call to 30 minutes, so I'd like to get started. Let me turn the call over now to PCRM's President, Dr. Neal Barnard, who is here to update you on all of our latest campaign progress. Dr. Barnard?
Thank you, Betsy, and thanks to everybody for being part of the call. I'm very grateful to you. I actually have some terrific news for you, but we also have some pretty serious challenges, and I wanted to let you know about both of them because they are both going to be very important to you. In the good news category, last year, as many of you know, we heard about some terrible experiments that were proposed in Taiwan. There was a rabies outbreak in some animals called ferret badgers. They're sort of like weasels. The concern was that the rabies would spread to dogs, so the Taiwan government proposed injecting beagle puppies with rabies. And you can imagine how awful that would be for the animals to develop rabies, and you know how horrible that can be. It starts as a prodrome of headaches and malaise, but it progresses to foaming at the mouth, becoming disoriented, and ultimately dying an agonizing death. We felt we had to stop this. It's cruel, and if a country like Taiwan that does not currently do a lot of animal experiments, if they got away with this, we felt that it would set the stage for much more of the same kind of thing. So we mounted a campaign in 2 directions. The first was scientific, to show that there is a better way to deal with rabies and that vaccines and so forth can be shown to be effective without these kinds of experiments. That was number 1, was science. Number 2 was media. So we worked very hard, both from here and on the ground, and we had terrific support from many of you who are on this call petitioning, but also the actress Maggie Q, Alec Baldwin, and quite recently Ellen DeGeneres jumped in and signed really strong letters of support that had a huge effect in Taiwan. So without me saying anything more, I want to bring in 2 of our scientific experts. The first is Dr. Mei-Chun Lai, and Mei is from Taiwan, and she also is a scientist working here full-time at PCRM. And in a minute, you're going to hear from Dr. Sarah Kavanaugh, who is an expert in viruses, and both of them have been intimately involved in this campaign. So, May, can I please turn it over to you, and can you give us the latest?
Sure. Thank you, Neal. Hi, everyone. After fighting so hard for this campaign for almost 9 months, I am excited to tell you that we've torn apart Taiwanese government's plan to inject rabies into beagle puppies. Because of your support and donation, our medical research specialist, Dr. Sarah Kavanaugh, and I were able to fly to Taiwan and work with a local animal welfare group called EAST. We also worked with Taiwanese legislators on the ground, held a press conference, and arranged a public hearing. In addition to that, Ellen DeGeneres wrote a letter to Taiwanese government and had huge media coverage in Taiwan. Under so much pressure, the Taiwanese government finally removed the beagle puppies from their current experiment plan. In other words, we won. We will continue to keep an eye on the government. If they ever plan to conduct these cruel experiments on beagles, we will hammer them again. All of this could not be achieved without your donation and support. So thank you very much. Also, we would not win if PCRM doesn't have the experts in biological science. During this fight, we evaluated the experiment protocol very carefully and showed the major flaws to the media. Therefore, I'd like to introduce Dr. Sarah Kavanaugh to you. Sarah, would you please let our members know how you used your expertise to fight for the animals?
Sure. Thanks, May. So as Dr. Barnard alluded to earlier, my background is in viral immunology, and when I was in graduate school, I actually studied viral infections of the brain. This means that I already knew a fair amount about rabies virus. Between what I already knew and the input of a number of external experts that we communicated with, we were able to critique the Taiwanese government's experimental protocol. This allowed us to put together a point-by-point report that refuted the experiments they proposed. At the press conference in Taiwan, we gave the media the background information about rabies virus and why we knew that the current vaccines would protect dogs, so that there was no reason to develop a new vaccine. The next day, when we had our public hearing, the Taiwanese government officials were forced to admit that they already knew that the current vaccine is effective in dogs and that they don't need a new one. Because this was the whole point behind their proposed experiments with beagle puppies, they also had to admit that the results from these experiments would do absolutely nothing to change Taiwan's rabies outbreak control policy. So ultimately, they were told by the legislators that the dogs had to be removed from the protocol completely.
Okay, so terrific, great work, May and Sarah. So it was really a 1-2 punch. You got tremendous amounts of press, and Maggie Q and Alec Baldwin and Ellen DeGeneres really stirred it up. But I have to say, if it weren't for the science of it and being able to convince the government that they didn't have to do these experiments, I don't think we would have had this victory. Also, I think, correct me if I'm wrong, but other animals are being used now. They are using some mice, and they are using some ferret badgers for this, and we've been chipping away at that. I believe we already cut down on the mouse experiments substantially. We've got our eyes on all of this, and so we'll keep everybody posted. So thank you for that. But so far, the news is very, very good. Why don't we shift gears? Betsy, let me bring it back to you, because I'm guessing that some of our members may have some questions about this, and then when we come back,
Yes.
There are some very, very disturbing experiments that are happening right here in the United States. Some of them are happening in Chicago. Prior to that, some have happened in Boston and some in Texas, and they are things that I am convinced we can win on too, in the same way as we won on rabies. But there's a lot of money behind these experiments, and I want to tell you about those. But first, before we get into that, Betsy, do you want to take some questions or comments from people?
Yes, let's do that. And while we bring up the first question, let me remind everybody that you can press 0 at any time during the call to be connected to a staff person and ask your question. And then when we can get to it, we'll pull you up live on the air, so you can still listen to the call after you have asked your question. And tonight, if you are inspired to support this life-saving work, we also have made it easy to make a donation tonight. You can press 7 at any time to make a donation to support PCRM's work. And let's bring up William Dussold from Maryland. Mr. Dussold, you're live on the air with Dr. Barnard.
Yes, Dr. Barnard. How did this incident regards to Taiwan come about? This is my first time hearing about that.
Okay. Well, thank you. First of all, thank you for your call and thank you for your support. And let me describe this just in a couple of sentences, and then maybe I might ask May to jump in as well, or Sarah. What happened was that rabies sometimes crops up in species, in the same way as it's in raccoons in the United States. It cropped up in Taiwan in these animals called ferret badgers, and that could happen. Where it was a problem was the government decided it then wanted to take the rabies vaccine and inject it into dogs as a set of horrendously cruel experiments. So that's why we wanted to jump in. May, did you want to add anything to that?
No, it's rabies virus, not rabies vaccine. They are injecting rabies virus directly into the dogs, and there is no vaccine protection at all. And we tell them that they should not do this and propose another way. And now successfully that they remove the protocol of dogs from their plan.
Good. All right. Well, thank you for your question. And Betsy, could you remind everybody what buttons they push, because they might get mixed up on what's to ask a question
Sure.
and what to make a donation?
Yes. So to support PCRM's life-saving work with a donation, you can press 7, and your donations help make all this possible, along with your petition signing and your phone calls and it's everything you do to support our work. We just couldn't do it without you. So you can press 7 to make a donation at any time. And then please, anytime during the call, press 0 to ask a question. And let's have our next question from Evelyn in White Plains, New York. Evelyn, you're live on the air.
Yes, I was wondering how you are going to monitor this after they say they are going to stop. How are you going to monitor that? Do you have somebody on the inside, and how far can this really go, and for how long can it go? Because I know in the past there's been experiments. They've said they've stopped, not just Taiwan, but everywhere in the world. And then we hear about things going back to the way they were. How are you going to monitor it?
Great question. May, do you want to jump in?
Yes. So we actually work with the local animal welfare group called East. So for the past months, we have direct communication with lab that is going to do the experiment. So this monitoring is not just like watching. We've been communicating with them, and we also can directly call the director of these experiments and to propose new ideas to them. So we have a very close touch with these with the government right now, and this is established when I and Sarah was in Taiwan. So now with this connection, we're pretty sure that we have all the updated situation from Taiwan directly.
Great. Thank you, May, and thank you, Evelyn, for your call, and thank you for your support. I must say that PCRM has worked very hard, not only to have the heart to fight these things, but also to have the expertise, because we really do need to have scientists. And with May being a doctoral level scientist who also knows the Taiwanese culture and speaks the Taiwanese language, and Sarah bringing in her expertise in viruses, it was really a great combination. But added to that, we have been in touch with the legislatures, and we have good contacts with actually the majority of the elected representatives there now. So we'll keep an eye on it, and I hope that we're able to stay on top of it. All right, let me move along. I mentioned earlier something that is really very troubling to us, and I want to get to that in a minute. If you can imagine scientists who actually kind of verge on what I'm going to call sort of sadistic behavior. which we have been uncovering, and I'm going to tell you about that. But before we do, we have something else that I want to share with you. We have some more good news. I want to bring up Ryan Merkley, who's our Associate Director for Research Policy. And Ryan has been working a really long time to get medical education free of cruelty. You know these labs where dogs are brought in and the medical students experiment on them and ultimately kill them. And then many of the medical schools then switch to pigs or other animals, hoping that nobody would care about them. Well, we care. And Ryan, let me ask you to come into the call, and if you have some news that you could share with us, please.
Yeah, thanks, Neil. And thanks, everybody, for being on the call and supporting our work. I have a couple of really exciting updates that we just learned about, in one of them in recent days and one of them in recent weeks. So as you know, since PeaceTerm's inception, we have been working diligently to get animals out of medical student training labs. Today, less than 2% of U.S. medical schools use animals, and I'm happy to report that that number just went down even further. What happened was, for years, we were trying to get Oregon Health and Science University in Portland to stop using dogs, and then when they switched from dogs, pigs, out of their physiology lab. And in this physiology lab, you bring in a pig, and the medical students would be asked to cut open the veins of the animal, and catheters would be inserted, drugs would be administered to the animal, and you'd monitor vital signs and ostensibly learn basic rudimentary human physiology on a pig. So we, for years, were pressuring the school, and we put up a billboard, and we worked with students and local physicians, and a couple of years ago, the school finally took all this seriously and undertook a really diligent curriculum review. They looked at students' educational outcomes who took the pig lab versus those who didn't take the pig lab, those who didn't take the simulation lab. And just last week, we got this great letter from the Dean of Medical Student Education at Oregon Health and Science University saying that in the upcoming academic year, which starts in just a few weeks, pigs will not be part of the curriculum. That leaves only 3 U.S. medical schools using animals: Johns Hopkins University, University of Tennessee at Chattanooga, and the University of Mississippi. And we've taken this letter we got from Oregon and are sending it to all those schools, trying to make them aware that Oregon undertook a serious curriculum review and decided that pigs and animals in general are not necessary to train future physicians, and made the right decision. On another note, last year, many of you may have heard that we launched a campaign to get Southern Illinois University in Springfield not to use pigs in their emergency medicine residency. So this comes after medical school. When you're trained to be an ER doc, you will go to your emergency medicine residency. And despite the fact that Southern Illinois University had never used pigs, they decided they wanted to start. We found out about this about a year ago now, and we launched a public campaign after, of course, we tried to communicate with the school about it. That public campaign involved lots of media coverage, a federal complaint, a demonstration led by a retired surgeon, and just a few weeks ago, we got a document from Southern Illinois University that said that protocol that was authorizing the use of pigs was canceled. And what that means is that because of our work, not a single pig was ever brought into the school or killed for this lab. So thanks to you and all the emails that you helped us send to the school and all the support you've given us to do all the things I described, we were able to stop that pig lab before it started.
Great. Thank you, Ryan. The reason this is so important is not just because the dogs or the pigs or the goats or whatever animals they're using, in some cases it's cats for these intubation things. It's not just that they are harming these animals, ultimately killing these animals. That's certainly number one, and that's what has to stop. But it's beyond that. When the medical students do these things and they're injuring animals or participating in killing them, it gives them this lifelong lesson that cruelty is okay, that science can't go forward without cruelty. And we started from the very beginning to want to stamp that out. And we've been very successful. So out of 127 medical schools, 3, Johns Hopkins, University of Mississippi, University of Tennessee, and Chattanooga, those are the 3 that are using animals, live animals now to teach medical students. We're going to stop all of them, but it's a job. They are the 3 most resistant ones. There are many others that are using them for emergency medicine and other things. We'll keep you posted. So thank you, Ryan. And now for the thing that I didn't want to tell you about, but we have to, and that is that some animals are used in particularly cruel experiments. And I want to bring Sarah back, but before we do, Betsy, do you want to remind people how they can get in the queue to ask a question, or if they want to make a donation to stop the cruelty?
Yes, we
Betsy,
have staff members standing by to take your questions, and then we'll get to them soon. You can press 0 to ask a question at any time, and also to make a donation to support this work so that we can keep going and save even more animals. You can press 7 at any time. So thank you.
Okay, great. In a minute, I want to bring Sarah back because she has been working very hard on a set of experiments that involve alcohol. And I just want to paint a picture of this. As you certainly know, alcohol is everywhere in society, whether it's wine and beer and spirits, and most people handle it okay. But a lot of people don't, and so there is fetal alcohol syndrome where fetuses are exposed to it, and there are alcohol-related accidents. And you and I might think that the way to deal with that is with education, with laws about drinking age, but it might surprise you to know that the federal government does animal experiments on alcohol. And some of these have involved having, say, sheep be given huge amounts of alcohol and exposing their lambs, their unborn lambs, to alcohol, and then the animals are surgically opened up, the lambs are removed, their brains are taken out, and that kind of experiment. But there is one that has really been very troubling, and it's because researchers, some experimenters, have had the idea that if the animals are small enough or unpopular enough, you just won't care. So there are researchers in Chicago at Loyola University who have taken mice and they give them huge amounts of alcohol and then they put them into boiling water to burn them. Other experimenters took mice, gave them huge amounts of alcohol, and then they broke their legs and left them in that condition. The whole idea here is let's see if alcohol makes it harder to recover from a burn. Let's see if alcohol makes it harder to recover if your legs are broken. And I have to say, for me as a doctor to hear about this, it seems simply sadistic. But we have to tackle these from a scientific standpoint. So anyway, with that kind of introduction and letting you know that we aim to stop this, Sarah, could you please come back into the call? Let us know a little bit about these experiments and about our campaign to stop them.
Sure. So the ultimate goal of our alcohol campaign is to convince the institute at NIH that funds these experiments, the National Institute on Alcohol Abuse and Alcoholism, to stop funding alcohol-related animal research entirely. And part of our strategy has been to highlight some of the worst experiments to show the public what taxpayer money is being spent on. So one of the examples that Neil mentioned is at Texas A&M University, researchers claim to be trying to understand more about fetal alcohol syndrome, and they're using pregnant sheep to do this. So pregnant sheep are surgically implanted with ports and catheters. Their fetuses are often implanted with ports and catheters as well. The female sheep is then injected with large amounts of alcohol over the course of an hour. It's approximately the equivalent of 9 to 10 shots of liquor for a human. She receives this alcohol for 3 days in a row. She gets 4 days off, and this cycle is repeated 4 times in an attempt to simulate weekend binge drinking in humans. Toward the end of her pregnancy, the sheep is euthanized and her fetus is removed, and the lamb is also killed. Its brain is removed, and the goal of this, according to the researchers, is that they want to see how maternal drinking affects fetal brain development. In an upcoming campaign, we'll be moving to Chicago, where we'll be exposing the Loyola University experiment. The point of a number of these researchers' work is allegedly to determine how alcohol affects the body's response to traumatic injury. So in one study, the mice are force-fed alcohol. So they're then anesthetized, and They're submerged in scalding water to produce a full scald injury over 12.5% of the total body surface area. These mice are not provided any pain medication, and 24 hours later they are killed. Another researcher injects the mice with alcohol. They then fracture one of the hind legs of the mouse. These mice do receive pain medication, but only for 3 days, and they're kept alive walking around on a fractured leg for 14 days before they're ultimately euthanized. So all of this research is being funded by the National Institute on Alcohol Abuse and Alcoholism, and we're definitely going to need a lot of support from PCRM members to convince them that they need to stop funding this kind of research entirely.
Well, thank you, Sarah. I have to say it's a little bit hard to hear that experimenters, people who call themselves scientists, would do cruel things to small animals and think that they can get away with it. Especially since if we're going to tackle these problems really, we need to deal with human beings. We need to deal with education. If women are pregnant, they need to be to understand that you have to not have alcohol during that period of time. And experimenting on animals is not the way to go. So stay tuned. We're going to ask everybody to help us with this. We will be asking you to petition. We'll tell you who to write to. We really do need your help with this. So my goal, if we are successful, number one, these animals will not be in these experiments anymore. Number two, our government will be on notice that when we are going to deal with problems like alcohol, like diabetes, like heart disease, that we don't think about animal experiments as the way to go. We think about how do we deal with these in human populations in ethical ways, and how can we deal with this in a way that doesn't make science embarrassed to be doing these kinds of things. Number three, my hope is that as scientists grow through their training and into their careers, that they will realize that certain things are just beyond the pale and that they don't participate in experiments like this, and that animal experiments would be the last thing that anyone would want to do. That's a tall order. We are not near that yet. We do need a lot of progress, but we are making progress. We're winning these campaigns. We're getting animals out of labs and medical schools. We won in Taiwan. I know we can win these things, but we've got to keep our nose to the grindstone. So we've got a really good team that's doing it. Let me stop at that point. Betsy, how about if we take another comment or two, and then we'll wind up?
Great. If people would like to donate to support this work that's just so important, you can press 7 while we're taking questions. And let's take a question from Kimberly in Missouri. Kimberly, you're live on the air.
I was just wondering how in the world scientists, supposedly intelligent people, could possibly think that the physiology of a human being is the same as an animal, how they can do these experiments on an animal thinking that it's going to make a difference in a human being.
You know, that's a great question. It's one of the things that we have been looking into and making a point of, that if an animal metabolizes alcohol in a different way, or if an animal heals in a different way, the results don't apply. But you know, there is one way that animals are very much like human beings, and that is if you burn them, they suffer. If you break their legs, they suffer. If you simply confine them and give them no ability to move around or to be with the companions of their choice, all of this is suffering for animals, and unfortunately many scientists overlook that. We aim to make sure that they are able to see that once and for all. So thank you for your comment on that. And for everybody who's on the call, I want to thank you for your support. I know many of you have called in your financial support, and if you haven't yet, please do. We really do need your help in order to win more campaigns like these.
Our next question is from Linda Ann Reynolds in Alabama. Ms. Reynolds, you're live on the air.
Thank you so very much for this honor. I have supported your organization for years. I also know about the experimentation on the monkeys to the point through the U.S. military that the scientists realized that it was depraved. My question is, how do we stop the lobbyists from granting these universities the money that they use as an excuse to brutally harm these animals? What is the value of life? And who determines what life is more valuable than the other?
Okay, terrific question. The way we have to do this here, the way that is going to win it is, number one, we do have to call it cruel as it is. We have to make sure that the ethics comes through loud and clear. It's just wrong. But we have to go beyond that and show that science can be done in another way. So we not only have to emphasize the ethics, we also have to emphasize the science part of it. Then we also work with the media, with the press. We have a tremendous communications department headed by Carrie Klein and her team, which is just terrific. And so they make sure that they get the word out, because scientists do not like to hear them about themselves in the press doing bad things. And finally, we are on Capitol Hill. Colin Schwartz and our legislative team are there working with members of Congress to get them to weigh in on these things too. It's all a tall order. It's all challenging, it's all difficult, and it's all expensive. But that's what we're doing. We've been doing it now for almost 30 years, and you've helped us do this. So thank you for that. That's the path to victory.
Our next question is from Dana Burns in Indiana. Ms. Burns, you're live on the air.
Thank you. My question is there an effective authority or a specific authority, kind of an overarching authority or methodology for making ethics a much stronger part of medical education, to instill really a stronger culture of ethics in medical education?
If anybody else on the call, Ryan, if you want to jump in, please do, but I'm going to say there is not yet. And medical ethics is barely touched on, and when it comes to animals, I don't think it's part of it. And that's why the work that we're doing is we really have to hammer that home. Until we raised this with Harvard and Yale and Stanford and all the other major medical schools, no one had ever talked about the ethics of it. And Ryan or anybody else want to jump in on that?
Yeah, Neil, I think that's correct, and I think there's I hate to use this phrase, but I think there's a sort of a trickle down effect to all the things we're doing related to the use of animals. Physicians, of course, I mean, I know you asked about medical education, but physicians, of course, follow the medical literature, and a lot of the medical literature at this point is written regarding animal experiments, and so much of what we are trying to do is pick that apart from a scientific standpoint and infuse the discussion with ethics. And I think physicians will follow that as well. And it's not just PhDs and laboratory scientists, but I think physicians will take, and medical students will take something from that as well.
All right. Well, that's a good point. Well, I know we have to wind up this call shortly. Let me just, if anybody listening to this call is thinking, this is horrible. They're breaking the legs of animals. They're burning animals. They want to give rabies to animals. Will this never stop? And the answer is it will stop. Back when we got started, live dogs were brought into virtually every medical school in America, and the students were killing the animals as part of a laboratory exercise. We've managed to stop almost all of those in a finite period of time. These rabies experiments, people said, you can't win. That's a country that's 8,000 miles away, and they won't listen to you. Well, they do listen, because you make a strategy that includes science, includes ethics, and you, as May said, you hammer them. You make sure that you win. We're not going to win everything, but we can win many of these things, and the people on this call, you have made this happen. Without you, it never would have happened. Without your letters, without your calls, without your emails, and without your financial support. So let me encourage everybody to be as generous as you can. Press that number 7 on your phone and make your voice heard. And if you're in the Washington, D.C. area, I want you to come by. I want you to meet May and Ryan and Sarah and Carrie and Betsy and Craig and all the other people who are on this team who are working with you. So that's all from me. Betsy, do you have some last things that you want to share with people?
Well, the support tonight is incredible, and our staff is working really hard to take all of your donations. So while they're working, may we take another question? And let me just say that if you are waiting to make a donation, you can also make a secure donation online by going to pcrm.org/puppies, PUPPIES. If you're still waiting for a staff member to take your donation.
Good. And while people are thinking, I'm sorry. Go ahead, Betsy.
Nope, I was just going to bring up the next question, but
okay.
Please go ahead.
But before you do, I just want to make sure somebody was whispering in my ear that it is so depressing for people to hear about animals being burned, and I don't want people to think that we can't win these. Let me give you two more quick examples. At Aberdeen Proving Grounds here in Maryland, the military was using animals as to test chemical warfare experiments. They used live monkeys to do this. We managed to stop it. We worked with Congress. Members of Congress brought in the generals who are in charge of this. We made the scientific points that they didn't need to do it, and they stopped it. And you'll remember about a year ago or 2 years ago, NASA was going to do horrible radiation experiments on monkeys, squirrel monkeys, these cute little monkeys. They insisted they had to do it. But you remember the work that Noah Gittell and others on our staff did. We stopped those. They never happened. So we will win. We're going to win these things. So I don't want people to feel this can't happen. We are going to have victories on these cases. So do press that number 7. Make as generous a donation as you can. We will put it to work. We're going to win for the animals. We're going to win for you. So anyway, sorry, Betsy. Do we have another call that we can take? And thank you to all of you, to everyone who is supporting this now. I'm very grateful to you.
Yes, we have Ava Strong in New York. You're on the air.
Yes. I basically was the same as the one lady that stated that the animals weren't the same as people when they were doing tests on them. But then you brought up the part with the military, and the military, they do other experiments on them too, and that's still going on from what I understand is with testing their weapons to see what kind of wounds and so forth that they would be leaving on them. Has anybody heard anything about that or done anything about that at that point?
Okay, terrific question. In fact, this goes back, just as you said, a number of years. Back in the mid-1980s, one of the very first cases we got involved with was people in the military, experimenters in the military, wanted to shoot animals to study the wounds, and they were using M16 rifles because they said it creates a bigger wound than just a pistol would create. And we said you don't need to shoot a dog or a pig or a goat in order to demonstrate that. And here in Bethesda, Maryland, they wanted to shoot beagles. That luckily they were stopped from doing that. Then they were shooting goats in a laboratory in Texas and another one in North Carolina. We worked very hard and stopped both of them. But you're right, there are other laboratories continuing, and we and other animal groups are working together to stop that. So thank you for pointing that out.
Well, that's about, we've gone over our 30 minutes, and unless you want to say anything else, we'll wrap the call up.
I just want to say a huge thank you. I just want to say a huge thank you. Thank you to everybody for your support, and thank you to the scientists and other staffers here at PCRM for making it work.
And yes, thank you all for joining us. We have questions that we couldn't get to, but when the call ends, you will have an opportunity to stay on the line, and you can leave a voicemail for us at the end of the event so that a staff member can get back to you tomorrow. You can also leave a voicemail at the end of the call if you would like to make a donation and didn't get a chance, and we'll call you back. And you can also go to pcrm.org/puppies. The support tonight was incredible. We just can't thank you enough for working with us as we tackle these hard issues.
All right, very good. Well, thank you, Betsy. Thanks to everyone who has been a member, and thanks to all of you who are new and are just joining in. We're going to win all these. We're going to work as a team. We'll see tremendous progress, and we will keep you posted. Thank you very much for your support. Come visit us and stay in touch in any way that you can. Thank you so much.
Thank you. Good night.